There are many symptoms that we have difficulties talking about, and one such topic is incontinence. Urinary, and even more embarrassingly, is that of bowel incontinence. I want to make sure that if you have either one of these and it's affecting your quality of life, to make sure you discuss this with your healthcare worker. The two most common causes of urinary incontinence are stress and urge incontinence. Basically, these are develop as a problem because of weakened pelvic muscles, pelvic floor muscles, specifically after childbirth, increased weight, certain medications, and in men after prostate surgery. And what happens is that there's weakened muscles, and with increased pressure with sneezing or exercise, laughing, coughing, you're going to have incontinence of urine. The urge incontinence adds a little bit more stress because you have that urge to go pee and you got to run to make sure you get to the bathroom in time to deal with that. There is another one that's sort of closely related to that, and that is overflow incontinence, and that is if you've had problems with your bladder and you're not emptying it completely, and then you are having excess urine sort of dribble out as you go. And this is more common in things where there's some nerve damage, like in diabetes, infections, certain medications, and with men with benign prostatic hypertrophy, a large prostate. Another cause would be functional, or where there would be either some mental or physical problem or disability. For example, dementia as a mental example, or arthritis as a physical one, where you have difficulty maneuvering around your toilet and things where you need some assistance with the hardware to deal with the incontinence. So how do you treat these things? Well, for the stress, the urinary, and the overflow, doing some exercises that increases the strength of the pelvic floor. For example, like Kegel exercises, which I'm sure many of you have heard of. And that's where we squeeze our anus and squeeze our perineum for 10 seconds, then relax for 10 seconds, and do that 3 times, maybe 3 times a day. That really starts to help strengthen your muscles, specifically for us seniors, because those muscles are leaving us if we're not working to keep them there, and we'll have more likelihood of having some urinary incontinence as well as some fecal incontinence. And there are other things that the doctor may suggest in terms of physiotherapy, specific kinds of physiotherapy that will help you to strengthen those pelvic floor muscles. When we talk specifically about bowel incontinence, this is a more common problem in the older adult population. And this is, again, from weak muscles, or, for example, diarrhea that might be occurring around a chronic constipation problem, nerve damage secondary to diabetes, cognitive problems secondary to dementias, Alzheimer's. There are many things that we can have at our disposal to help these symptoms, and that's why it's important to discuss this with your healthcare team. The final thing we just want to consider is, for a moment, is the bowel incontinence, which is a common problem, especially amongst seniors' older population. And the causes are basically the weak muscles, which we've alluded to before, as well as having loose movements around a chronic constipation. Nerve damage with diabetes, cognitive problems as in a dementia and Alzheimer's. And this has a very major social impact on your life. And for sure, if it's really a problem for you, is to make sure that you want to discuss that with your healthcare team, your family doctor. There's all kinds of treatment for it, and we're not going to go into all the particulars, but there's certainly things that can help you with the symptoms. And making sure to deal with your constipation, increasing the fiber in your food, avoiding caffeine, making sure you're well hydrated. I think most of us don't get enough water during the day to deal with that that chronic constipation. And the exercises, the Kegel exercises, and there might be other treatments necessary. That's going to depend on the results of your visits to your healthcare team. But there's some products that will help you in terms of the actual symptoms. So one can get the incontinent garments. There are pads inserted inside your own undergarments. You can use this also for urinary incontinence. There is the underwear that is with the absorptive pad that is disposable. You can also get pads and an undergarment that you can wash for those, and this is where your symptoms aren't that bad, where you can keep that on. It's a lot more comfortable, including disposable undermats for your bed, as well as mattress covers to prevent that staining of all your sleeping materials. So those are the things that I've wanted to discuss with you. The last thing I want to let you know is make sure that this is a problem for you. To see the doctor, just tell him, listen, I've got some bladder problems, and he'll want to know how long, how much it's bothering you, and then take it from there, which may require further referral, but don't hesitate to bring it up. Talk to you again.